This is an analysis of the town of Belleair, Florida, presented to you by Emily Fraser Lewis. Belleair is a thriving community whose history begins in 1890 with railroad mogul Henry B. Plant building a luxurious upscale hotel south of Clearwater called the Bellevue Hotel. It was home to two 18-hole golf courses by World War I. In 1920, it was purchased by John McEntee Bowman, owner of a chain of hotels named the Biltmore, and then became known as the Bellevue Biltmore Hotel, operating until 1940. The town of Belleair was officially incorporated in 1925. After the stock market crash in 1929, the early 30s brought about desperation, with the town defaulting on over $1 million in bonds. During World War II, the Bellevue Biltmore became Army Air Corps training posts and fields. The 1950s marked a time of new growth all the way through to the 70s, when U.S. Steel purchased land and new condos were being built, increasing the population. Steady growth has occurred since all the way into the 2000s, giving us a combination old charm and new world feel of Belleair, Florida, housing approximately 4,000 residents. Belleair is relatively small in comparison to surrounding Largo and Clearwater, with just under 4,000 residents. Largo and Clearwater combined have approximately 200,000 residents, with a median age of between 43 and 48. Almost 30% of Belleair's population is over the age of 65. With an aging population comes community concerns such as increased health risks for coronary artery disease, heart attack, stroke, hypertension, and falls. The estimated household income is higher than the average, financially reinforcing the community with poverty levels less than 4%. Belleair is an educated community with low unemployment rates, just under 6%, and low crime rates. One noted difference from Belleair to its surrounding counterparts is diversity. With 93.5% Caucasian, the lack of diversity can lead to prejudices, judgment, and stereotyping. This community analysis will include structure, population, environment, health-related resources, government, with the goals of the analysis to prioritize community problems and discuss global community issues. The real estate in Belleair, Florida is mainly single-family homes with the incorporation of a few condos and minimal apartments. While there is some new construction, many homes, although beautifully manicured, appear to be older and built in the 1970s or before. The streets are clean and lined with lampposts and palm trees. There are no electrical wiring that is visible to the naked eye. There are some condominiums, and many appear to be revamped hotels, also dating from the 1970s. Housing varies from single-level to multi-level properties, and all properties were structurally intact and well-maintained. Each property was well maintained with the neat lawns and prim landscape. There's no trash or waste that lines the streets, and there are few businesses within the town limits of Belleair. Fewer business leads to less structural problems. The Dimmitt Rec Center, the town hall, and the police station are all in the center of town and represent a few of the commercial buildings as well as the public works building. But there are no grocery stores, no schools, no libraries, and no convenience stores. Because Belleair is so small, it doesn't seem to affect the community because they can all be located in surrounding Largo, Clearwater, and Belleair Bluffs. Some foreseeable problems with the structure of the community is immediate access to groceries, gas, and pharmaceuticals. But these resources are located within 4 miles. There is really no comparison for health-related resources. Very little is located within the city limits of Belleair, and all Belleair residents mainly depend on Largo and Clearwater for their healthcare needs. The only acute care hospital located within the area is Morton Plant Mease Hospital, located in Clearwater, just south of Belleair. Belleair has very little skilled nursing and assisted living facilities. Although there are some, many are located in surrounding Largo and Clearwater. The same goes for walk-in clinics. There are none located within the limits of Belleair. Most are located just outside the city limits. This does not make healthcare accessibility high on the priority list, but it is accessible, being that Belleair is very small and each is within several miles and driving distance. Healthy People 2020 is an initiative of goals and objectives for health promotion and prevention initiated by the Department of Health and Human Services to come alive in communities and workplaces. The following 3 goals have really come alive in the town of Belleair, and they are working hard towards achieving these goals and reducing prevalence of these health disparities. Cancer is the #1 leading cause of death. The monitored objectives of this goal include incidence, mortality, and survival used to gauge a decrease in prevalence. Education and reducing preventable risk factors such as physical inactivity and obesity are key. Diabetes, which is the 7th leading cause of death, and reduction of its financial burden while increasing quality of life is goal #2. The percentage of people in Belleair living with diabetes mellitus is 9%, and it is comparable to the state of Florida at 9.2%. This education on nutrition and encouraging physical activity is key to preventing diabetes. The final goal for older adults is to improve the health and function and in turn increase quality of life. That is the key to this goal. Overall, these goals are being strived towards within the community of Belleair. The leading causes of death in Belleair are the same as in Pinellas County: cancer and heart disease. Passing heart disease in 2011, cancer is now the leading cause of death for Floridians. Florida has the 2 highest prevalence for cancer and heart disease in the nation, with causes including poor diet, obesity, and lack of activity. Over the last decade, deaths related to cardiac and heart disease have decreased overall. Cancer is a concern in Belleair and Florida in general because of the excessive exposure to the sun and its dangerous UV waves. A preventative choice to decrease risk is applying sunscreen and covering up with appropriate clothing. A modifiable risk factor for heart disease is sedentary lifestyle, which Belleair does a great job at offering health promotion programs and activities for all ages to battle this sedentary lifestyle. It has also been shown that exercise may decrease side effects of cancer and those related to its treatment. The town of Belleair does not have an active fire department or station within its town boundaries. The county of Pinellas handles all fire, EMS, and first responder needs for Belleair and its surrounding communities, Largo and Clearwater. There are 19 municipal and independent fire departments throughout Pinellas County. The police department of Belleair is located connected to the town hall. The department consists of Bill Soule, Chief of Police, and Lieutenant Jeff Wolf. There are a total of 10 full-time officers and 5 part-time officers. The supporting services for these offices consist of an executive secretary, an administrative assistant, and 3 clerks that work part-time. The Pinellas County Emergency Medical Services Authority was created in 1980 and part of a special act of the Florida legislature. EMS services were consolidated with the fire departments to create an integrated countywide 911 operation. The current EMS system is known as a public utility model and is in combination of the most clinically competent and cost-effective medical care. The ambulance vehicles are contracted on a performance basis, and the current company operating under the county's name is Sunstar Paramedics. The Town of Belleair Commission is made up of the mayor, deputy mayor, and 3 town commissioners. Each position within the commission is an elected title, voted upon by the citizens of Belleair and elected to a 3-year term. Their main responsibilities include writing policies, enacting the legislation, and managing and approving the annual budget. Twice monthly, they hold public meetings in the town hall to discuss current and pending issues at hand. The town commission also appoints the town manager, who is responsible for overseeing and managing all 9 departments of the town of Belleair. Currently, there are no issues with the budget, and the funding sources are adequate, as well as the allocation of the funds for expenditures. There are no other issues regarding public policy and government within the town of Belleair. While community issues are minimal in Belleair, Florida, the following is a list that I have comprised of community issues that could pose as potential problems. The first is healthcare accessibility. While Morton Plant Meads Hospital is located within minutes, in order to maintain quality of life, access to primary care physicians and adequate medical resources are important. Within the town limits of Belleair, there were only 2 medical doctors noted. Second, lack of churches. Religious representation is limited, and traveling distances may inhibit attendance and quality of life. Thirdly, lack of access to schools. Although surrounding Clearwater and Largo have many options for public schools, lack of schools limits the options and presents problems of attendance for those who have to travel far. Lack of diversity could pose as a problem of proper representation of a population within the community when decisions are made. Low-income housing. With less than 4% of the population below the poverty level, there still remains some of the population which has no local resources within the town limits. However, there are multiple resources within miles and in the surrounding areas of Clearwater and Largo. Lack of shelters, outreach programs, and homeless resources means a portion of the population may not have basic needs to sustain life. These are all issues, if not addressed, that can affect the community of Belleair. Care should be available, appropriate, and affordable. When we think of issues on a global level, it can make the world a much smaller place with a connected population of people dependent on one another. Nurses share a vision to promote and protect health and can be at the forefront of intervention and education. Access to health care is a global problem, with one end of the spectrum being worries for readmission to the hospital due to lack of primary care, to the other being an infection caused by unsanitary fecal waste disposal in a third world country. The spectrum is broad, and over 1 billion people have no access to health care. While the town of Belleair has minimal concerns with its access to health resources, other countries don't even have clean drinking water. Some answers to this disparity have included vaccination clinics, public transportation for the disabled, medical humanitarianism organizations, pharmacies that deliver to the bedside of a hospital, volunteer organizations, clinics, preventative care, pharmaceutical donations and assistance, and education of all kinds. Community-based collaboratives need the support of all, including policymakers and government leaders. While this is a global issue, it can be seen in each community worldwide. Making strides to make this disparity disappear starts at a small level.
Countries like Europe realize the aging population and its difficulties with access to health care, and have implemented several technological solutions with a concentration on prevention and assistance. Telehealth is a huge field that is up and coming in the United States as well as Europe. Patients can now be monitored from home, and their cardiac and pulmonary status, as well as other fields, can be sent to the doctors and nurses. These are just a few of the efforts in this new solution for the field of telehealth. Community nurses' roles include home health care, assisting with the home monitoring, home infusions, preventative care, education, and educating patients on community resources. In the attempt at a solution for these global issues of access to healthcare, countries like Europe, realizing the aging population and its difficulties with access to healthcare, and have implemented several technological solutions with a concentration on prevention and assistance. Patients can now be monitored from home. Both their cardiac and pulmonary status can then be sent to doctors and nurses alike. These are just a few of the efforts in this field of telehealth. The community nurse's role within the field of telehealth would be assistance with home health care, home monitoring, home infusions, preventative care, education, and community resources. Molding the community nurse and filtering her into the society is really going to help with global issues at the community level.